Hello, this is Dr. Robert Bouvier with the Health Centers of Michigan, and I'm sitting here with Jennifer from the Helping Hands, and this is a video about the kit. You ready for the kit?
I am ready for the kit.
So you were sent here by Jennifer, Jennifer who pays your paycheck? Okay. By Jennifer to understand more about the kit. And the kit is in the people's homes. It's used as a first aid kit. It's used as a what-if kit, meaning that take a COPD patient, if they're having an exacerbation, or let's call it a pre-exacerbation. They know that they're not feeling very well, and if they had that stuff they gave to them in the hospital, then they probably wouldn't have to go in the hospital. So this is really a pre-emergency medication kit and other things. Like we'll keep a pulse ox in here for the COPD patient. We'll keep a peak flow in here. They can use all sorts of stuff here for the pre-emergencies. Okay? Does that make sense?
Yes. These are designed just for the specific patient, correct?
Every patient truly is different. And even every COPD patient is different. And what I mean by that is, I know they all have chronic bronchitis, emphysema, or cystic fibrosis or something like that. But every patient's education is different. The caretaker's, education is different. The staging of where the patient is at is different. The home health care nurse's educational experience is different. You could have an intensive care nurse in there that has seen 100 of these people, or a new graduate nurse who's like, oh my God, what do I do now, right? So there's a lot of difference between the educational, not just from caregivers. The doctor may be a newbie doctor, or maybe somebody who's not comfortable, but the demographics, all the little variables coming up to it are different. So these kits are made up to make people feel comfortable. Does that make sense?
Yes.
So we'll put meds in here like like what's in this kit. A lot of people we'll take that COPD patient. They have air hunger. They're breathing at 40 breaths per minute, and they wake up at 3 o'clock in the morning. They wonder what they have to do. Well, we've already gone through this with them 4 or 5 times in the hospital, right? So the kit is here to help them get through their mess. So they know that there's probably a few drops of morphine in here in a 1 unit dose where they can drop underneath a tongue this thing. There's some Zopanex in there. There's a peak flow meter in there to let them know, and a little document thing, piece of paper where they can write down what their peak flow is now and what it is. They can communicate with me via Skype. Just the orders are in there, and they understand what they have to do because they've gone through it. That's the contents and how you would kind of use the kit. And we'll have all those orders in there in their book, and we'll have another conversation about the book. So, you have any questions? You got anything else about the kit that maybe they need to know about? Or
Who makes up the kits?
That's a good question. The families make up the kits. The contents, the doctor comes up with the contents. As a home health care nurse, you're totally say, hey, can we add this to the kit? Your main function when you get a referral is, okay, let me see your kit as part of your deal going into the hospital, right? But each patient needs to own this kit, right? So this kit could be like, this is my dad's, this is my parents' kit, and he wanted to have a toolbox because he's a mechanic type. But I've got people that use a Kroger grocery sack, some shoe box or something. But the idea of that is that it's theirs. They take ownership. The number one objective, our goal is to keep people out of the hospital emergency department, and number two, to delay the onset of stroke and heart attack. But our objective, our number one objective that we want with every patient is to get them to chase after us as healthcare providers instead of us chasing after them all the time, right? Right. So if they own the kit, if they own the actual box or container, then they tie right into us. It's kind of like the book.
So when we ask a patient in a home, do you have Dr. Bouvier's kit?
No,
it could be a grocery bag or something else. It's just considered the kit.
It's the kit. So when you ask them for the kit, they'll take you to their kit. And if they look at you with a blank stare, deer in the headlights, they don't have the kit. So I'll say, okay, let's get your kit. Let's get it on board. Obviously, Dr. Bouvier is not doing his job. Or it could be me or a host of other doctors who are starting to use the kits. Does that make sense?
Do all patients have a kit, or only the ones that need the kit under certain criteria?
At this point, I want every 100% of my referrals to have the kit. Eventually, we'll have everybody else too. The other part of the person who does the kit would be the pharmacist. Every one of my patients have a pharmacist who actually delivers to the house. Now, sometimes these kit contents change, so we might have the pharmacist deliver the kit contents to the hospital before the person's discharged. And that really helps the patient have confidence too.
Good.
Any other questions?
No.
If you have any questions, please ask Jennifer about the kit. You can call me and ask me about the kit. We can Skype and we can talk through those protocols. If you have any additions that you think should be in the kit, then take that expertise. We totally appreciate your input. If you think something's not working in the kit, that we ought to change it, let us know that too. Again, this is Dr. Robert Bouvier, Jennifer from Helping Hands. Thank you very much.